Today let's talk about the single best exercise for lower back pain. And I mean it. I don't care if you've had chronic pain, if you have herniated discs, if you have bulging discs, an injury, whatever, this is the best exercise you can do. So first of all, I'm Dr. Stephanie Mayer and I specialize in helping moms decrease back pain so they can return to the gym. So, the single best exercise for lower back pain is an exercise that does not hurt. It is the least painful movement. So, I am actually going to give you two things to try today. I was going to give you one, but I'll give you two just as a bonus, just to make sure we fix this. But I need your commitment. If you do have pain, I want you to do, you can pick one or you can pick both of these to do twice a day for the next few days. And I promise you, it will decrease it at least 90%. And if it doesn't, you can send me a message and we will work through it together because there's a couple more motions you can try, but this normally works. So, let me show you. The first one you're gonna do is a trunk rotation. So you're gonna sit up nice and tall, you're gonna cross your arms. You are going to rotate as far as you can to one side and look behind you too. Really go all the way to the end range of motion as far as you can. And then come back. And now go all the way to the other side. After doing that, I want you to assess what side is better than the other. Is one, think of pain, think of restriction, think of tightness, think of tingling, anything like that. What side is better and which side is worse? And now rate it. Are they minimal? Is it a minimal difference, moderate, or a significant difference? Now I want you to think of a percentage. If it's a minimal difference, 10, 20, 30% difference. If it's moderate, 40, 50, or 60% difference. Or if it's significant, 70, 80, or 90% difference. Rate them. Now to treat this, you are only going to go to your good side. Avoid the bad side. For the next week, until your pain goes away, avoid all motions that hurt. So if going to the right was the least painful way, I want you to cross your arms and rotate right 25 times. Really getting all the way to the end range of motion as much as you can. Super important. So you would go like this. 25 times. Then you would relax for about 30 to 60 seconds, and then you would go 25 times again, only to the good side. Then you will retest. You will again rotate to the right. See how it feels. Rotate to the left. Is there a different imbalance between sides? Does it feel better? If it feels better, you are going to do that rotation again. 25 times, relax 25 times. Now if it keeps getting better, because you retest every time, if it keeps getting better, you keep going. Keep going until it stops getting better. Why stop a good thing, right? If it stays the same, then you do it again. If it stays the same again, then you could go move on to the second exercise I'm going to show you. So you keep doing 2 sets of 25 twists, retest until the pain's gone or until it stays the same twice in a row. Now I'm going to show you another exercise you can do, which is a straight leg raise. So you're going to sit with the chair that doesn't have a back. You can grab underneath and you're going to pull one leg up and back down and pull the other leg up and back down. And now with this one again, you're going to rate it, minimal, moderate, or significantly different. What is the percentage? And then you're only going to treat the good side. So if it's the right side that felt better, for this one you're going to hold it. You're either going to hold it up here for 25 to 30 seconds, and you can slouch back. You don't have to stay up tall. You really want to feel a stretch. Hold it for about 25 to 30 seconds, or you can bounce a little bit at end range. Whichever one feels better for you. And then you're going to retest. You're going to hold it 25 to 30 seconds, relax 30 to 60 seconds, and then redo it again. After you do it twice, you're going to retest sides. Test the right, test the left. Do they feel closer? Is there as big of a difference in pain or restriction or tingling to either side? If it feels better, you do the 2 sets of 25 to 30 seconds again. If it stays the same, you still do it again until it stays the same twice in a row. If you do these 2 exercises twice a day for the next couple of days, I promise you, it will feel a million times better. and I want you to send me a message. I want you to tell me that you're doing it, and I will help you through it. And for some reason it doesn't, I will give you some of the other motions that help. These are usually the two easiest and the best two, but there are a couple more that we might have to tweak or modify or something like that. I'd be more than happy to help you. Because the thing is, in PT, a lot of times we work the bad side. So if your back is really hurting, it's going down that right leg, we stretch that right leg, we strengthen it. But really, we're just pulling on that bad spot. It's not always the back that's causing it. Usually there's a muscle above or below that's causing it to be out of whack. It's like a towel. So you have a twisted towel and you want to untwist it. Would you keep going the same direction? Or would you untwist it, working the other muscles to loosen it up? That is why this works. We need to treat the good side. It's not no pain, no gain. There's no reason to just keep cranking on what's painful, what's injured. Instead, let's fix what's causing the pain and the injury. The surrounding muscles, let's loosen them, let's work on them. So make sure to send me an email, a message. I would love to help you. Really make sure you get this right. In the comments, I'm going to leave a link for my core dysfunction self-assessment. 3 easy, simple tests to see if you have a core dysfunction, because we'd get rid of the pain doing this first, and then we would strengthen it the appropriate way. And if you have anybody that has any back pain or anything like that, please share this with them, tag them in it, because so many people undergo so many months and months of therapy, injections, meds, and half the time it doesn't work. When something like this seriously has about a 90% success rate. I'm not even kidding. So give it a try, let me know, email, message, anything, me personally, and I will reach out and help you on an individual level get rid of it. All right, have a great rest of the day.